Camille from Peru, look at you.
Hi.
Hi, Camille.
Hi, Dino.
Wow, that's exciting.
Yeah, I feel like I have no excuse not to be here. With the internet, you can be anywhere you want.
Well, thank
Yes.
you. Thank you. Oh gosh, it's going to be an exciting thing. Amanda's on too. Amanda, we can't see your thumb. Put your
Hi,
thumb
Amanda.
up.
Hey.
The
All right, I'll try
reaction
and
thing.
figure out. My thumb is up. You just can't see it.
Oh, like you know all the answers to the questions, huh? You probably do know. Now I got to think of, some of you guys can't answer these questions. Here we go. We're going to go with the first one. What year was Etta Projects established? Oh, Amanda knows.
But is it cheating? Because I
It
worked
is
for you.
cheating because you do work for us. But hold it. Let somebody else go, and then we'll see if you're right.
2001.
All right.
Oh, Janice said 2001.
2002.
2002 is not right.
2003.
2003.
What'd you say, Nancy?
2002.
Nope.
2005.
2003. Amanda gets it. Amanda, you just wanted a new t-shirt.
You ought to see the one I'm wearing right now.
I don't want to. Okay, here's question number, let's see. Okay, here you go, Doug. You ready?
Maybe no.
What's the symbol for the Amboro National Park?
It's the bird.
That blue horn.
Bird.
Which is called?
The blue horny bird.
There's also a drink by the same name.
I'm gonna call it.
I know it.
Okay, Nancy's got it.
A horn curacao.
Oh, way to go, Nancy. Put him to shame. Put him to shame. Wow. Okay, here's another one. Name the precious stone found exclusively in Bolivia.
I know.
Susanna, I know you know. Amanda, I know you know.
I know.
Camille, she wants a t-shirt.
Yeah, but I won't hold you to it. You can't, it's too far to mail it here.
No, you'll have to come see us and I'll give you one.
Oh, okay, it's a deal. Bolivianita.
Yay! Well, way to go, Camille. All right. Are we, and Jean is now here. Should we do one more and then we're done and we move on?
Do one more.
Do one more. Here's our next one. What are the two capitals of Bolivia?
La Paz and Santa Cruz.
No. Where's our sound effects, Kat?
Oh.
I'll be your sound.
All right. Somebody else go. Jean, Gloria, what is it? He got one. What'd you say? La Paz.
La Paz.
What's the second one?
Sounds like sugar.
I don't know. I'd actually hear the question.
Sucre.
What are the two capitals of Bolivia?
Ding, 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 ding.
Oh,
Sucre.
Ah, Joe. Way to go. All right. Well, tonight we're going to talk about COVID. I'm going to switch gears here. And thank you all for coming from all over the world. This is exciting. We have Canadians, somebody in Peru, we have Bolivians, we have people from everywhere, Washington State. And so thank you all for coming. And there's two more right behind me, obviously. Dana put up if you look at the message there, Dana put up the facts as she knows them. Anyway, tonight we have Dino. Where'd Dino go? There he is over there.
Here.
Okay. Dino, I'm going to
everyone.
introduce Dino. Dino joined Etta Projects in March of 2017. He's Italian, but he has lived in Bolivia since 2014, where he previously worked at Comedor de Niños Etta Turner, or worked for the first initiative undertaken by Etta Projects. He has a master's degree in economic development and international cooperation. As program director, he oversees all the project activities carried out by program staff. These include community needs assessments, monitoring and evaluation of past and present Etta Projects programs, and the development of new projects and relationships with local authorities and partner communities. So we thought people might really just want to know what's gone on with COVID in Bolivia, because their response has been very different than our response. Of course, they have a lot fewer resources, but that's where we decided we wanted to start. So, and we're gonna do this on an interview style with me asking some questions and Dino kind of responding to that. And then we'll have another time when you guys can all ask questions. So Dino, I know the first case of COVID in Bolivia was confirmed on March 10th from a traveler. And unlike in the US, you guys had complete nationwide response. Now you live in Montero, which most people may not know, with about 130,000 people. And it became the epicenter of the virus initially. So can you tell us how people and the Bolivian government responded?
Yes, okay. So first of all, welcome to this talk, and thank you for joining us. And I'm very thrilled and excited to be here with you all tonight. So I'm gonna try to share with you the information I have and some experience that personally and professionally I've lived during the last months here in Bolivia. So the COVID breakout, as Pennye said, struck in Bolivia in April mainly. So we were in the really very epicenter of the pandemic here in Santa Cruz. I don't know if you have a map that we can show you. So that's the whole Bolivia, and you know where you can see the red big spot in that map, right in that center, that's where Montero is. So we were so lucky to be just in that spot, in that bad spot. And you know, during the first 3 to 4 months, we had kind of 50 to 100 positive cases of COVID-19. So the government response was firstly shut everything down. So no people could travel across, you know, the department borders or even from town to town. Then no economic activities even. So the banks were shut down, even the markets, Etta Projects. I mean, we couldn't go out to our communities, of course, even though we are working in public health, you know, we couldn't go and reach our communities because there were the military and the army in the streets. So Montero was a special case because we were like the patient zero of Bolivia. So that's why we need to be really careful to go out and just stay home. So the thing here in Montero was that we had 1 day per week to go out and do our purchase and go our shopping. So who decided when was our turn to go out? Depending of the final number of our document, we could go out. And for example, my number was the 9. So all the 9 and 0 were on Fridays. So I could go out just on Fridays. When things went worse and worse, and then I'm gonna explain why they went worse and worse, there were another you know, enhancing of the rules of the Montero part. The rules were, okay, you're a woman, you can go out just in the morning, and you are a man, you can go out just in the afternoon. Why women in the morning? Because normally women are the ones who cook here in Bolivia for the family, so they can go out to the market and do all the shopping for the whole family. And of course, there was nothing left for the men in the afternoon. So it was a challenge for me. And it was like, you know, I hate to rush in the first hour of the afternoon, on my Friday afternoon, to go and do my shoppings. This was during 3-4 weeks here in Montero, from May to early June, you know. So this why the things went bad and worsened here in Santa Cruz. The social distancing is difficult here. I mean, Bolivian are really warm people. They just stay all together in family and out of the family, even in work. You know, every single excuse for gathering and stay together and have a nice chat is welcome. So that's why it was so difficult for them, you know, to maintain the social distancing. And of course, there is a lot of informal work here. So if you're not working for, you know, a bank or, you know, an enterprise, a company, and you don't get any retribution every month, you need to work every day for your subsistence and over your own family, of course. If you are not allowed to go out and sell, for example, your lemonade or your fruits or whatever you are selling or do your service, so after some days, your family and yourself will starve. So many people here in Montero, especially in the peri-urban area, were forced and obliged to go out and work, concealing, you know, from the authorities so that they could not be caught. But yes, that's where most of the people got the COVID-19. So that's why in Santa Cruz, especially geographically, the maps of the COVID was outside in the peri-urban area of Santa Cruz and also in the peri-urban area of Montero. And we have another picture of people with a coverall, with a jumpsuit, who are just fumigating the streets. And that's what the activity that the municipalities undertook during many days in the first 2 months here in Montero and in Santa Cruz and all. So this is in general what happened during the first day of the breakout of the COVID-19.
Did they use the police to enforce things, or who enforced whether people were on the streets or not, Dino?
Yeah, I mean, there were here in Montero, there were the police, and later on in the early June, there were also the army. But in some neighborhoods, some collective groups of neighbors just organize themselves to make just rondas, they're called. I mean, they go just round the neighborhood and check that everyone is not going out of their homes. Otherwise, they would have paid some fee or something like that.
Okay. So can you tell me about the healthcare and the hospital realities that people in the government faced during that time?
Yeah, of course. So the public health in Bolivia, so we need to tell that has been facing a long crisis since before the pandemic. So the deficiencies that have been dragging on for years have to do with every single municipalities and of course the government. So there was lack of budget in every single municipality and lack of health staff. So in a municipality like Montero, which is big compared to another, which is, for example, Buenavista, with just 15,000 and maybe more citizens, you can understand that the budget was really low for some towns. So if you don't have much money to use for the to help the spread of the COVID, you will see that there will raise problems. So the first problem is that the hospital had not the lung respirator or intensive therapy. So the data that were updated up to July of 2020 say that in the whole country, 1,200 people were in need of intensive therapy. But in the whole Bolivia, we had 490 high intensive therapy and just 180 lung ventilators. I mean, like 80% of people would have not have needed the lung ventilator, but would not have used it because Bolivia just didn't have it. So, and this was really tragic because many people during May, June, and July died in their homes or, in the hospital, just because they couldn't get to reach the intensive therapy. In Bolivia, there are intensive therapy in the private hospitals. There are private clinics. We had a really bad and sad experience with one of our ex-workers of Etta Projects, where he needed an intensive therapy. But I had phone calls in some hospitals in Santa Cruz one night, and for spending just one night in the intensive therapy, the family should have spent $1,500 each night. So for the average Bolivian family, this is not even possible in the, fairest dreams, So many people just could not afford to pay for their life. So this is how bad it was here in Bolivia, Also, like, what's this? I mean, there were not PPE in the hospital. We have one doctor in our staff. Some of you know her. I mean, she's called Caterine. Caterine has been working in the healthcare system of Bolivia for more than 17, 18 years now, I guess. So she works in the public healthcare system. She told us that she had to buy all the PPE tools, the gloves, the face mask, and the coverall jumpsuit, everything, in order to attend the patients. Yeah, that's Caterina, the woman in white. So she had to buy that, and all the health staff in Montero, and I would say in the most part of Bolivia, should have bought all the PPE, and maybe some of those, maybe the nurses could not afford it. That's why 80% of health staff got the COVID. Many of those got in early May the permission to go out and rest in some hospital or in isolation in their homes. But soon, when the patients were more and more, sadly, they were obliged to go and work even though they had a COVID-19. And that was not a good idea because, it was just a negative feedback in the response of their own bodies, So this is what was like for Montero and for Santa Cruz in general during the pandemics.
So Dino, can you tell us what quarantine looked like in the rural communities where we work?
Yeah, so the rural community, I know that some of you already know some of those communities. So you know that to reach those communities, even if they're not far away, some of them are near here, like, don't know, 20, 30 kilometers. Some of them are really just far, like 50 kilometers. And they are just on dirt roads, dusty roads. And before the pandemics, the connection were bad, of course. So, and now in the isolation, I mean, with no public transportation, they were just completely isolated. They could not go to the market except for that one day that they were allowed to go. But the thing is that, I talked about the work. In rural communities, they are used to work to earn money by selling their products. For example, in the area of Buena Vista, for example, in Espejito or San Carlos, Sevilla Imperial, in those communities, they sell citrus, so oranges and mandarins and lemons and so on. So they weren't allowed to go out and sell those products to the market. So it was really difficult for them to get their incomes. And so the subsistence was harder. But, most of the families have their little gardens where they can grow their their tomatoes, their onion, their corns. They have, you know, the animals, the like chickens, some of those cows. So they could resist to this isolation. The bad part of that is they just ran out of supplies. Just in early May, we received many phone calls from our health promoters asking for supplies. They asked Katarina, they asked me, please Dino, please Katarina, send us some ibuprofen, some amoxicillin. We don't have gloves, we don't have face masks. And I asked, why are not you asking to your local clinic? And they say they run out of everything. They are not giving us nor even the paracetamol or ibuprofen. So, and when the little towns like Buena Vista or San Carlos started to run out of PPE and even health staff because they were ill, the health staff remained in the rural area who were not COVID positive, who were just in good health, were called from the hospital, from the general hospital of their towns to attend people there. That was the case, for example, of Espejitos, of Villa Imperial, that are two of the main communities we are working, we have been working in the last 2 or 3 years now.
So you're saying the doctors who were in the rural clinics were called away to the bigger hospitals or clinics to work, yes. And so then the rural areas were left with no physicians, no professional staff at all.
No professionals, just nurses or you know, the auxiliary nurses, and you can see that you know, the only people who had some knowledge of healthcare were our health promoters. So that's where and when they become really, really active and needed and necessary in our community. So that's where, of course, with Katerine coordination through WhatsApp, because you know many of our ACS have a cellular phone, a normal cellular phone, and I'd say that 70% of them have a smartphone, so that they were able to send pictures of some patients, or you know, just chat through WhatsApp with us, and we could do the follow-up with them to some of the patients. So I have an interesting story. I don't know if we could show the picture of one of our health promoter. It's in our number 7 picture. Her name is Doña Martina, and she's from Rio, Colorado. I put just a map. I mean, it's not a really good map, but you can see where is Buena Vista. It's just in the center, in the heart of Bolivia, you know. And Rio, Colorado is a really little rural community past a couple of rivers without any bridge. And she's the only health promoter in there. In Rio, Colorado, where at least 120 people now are living. So she called Katarina one afternoon. She told her doctor, you know, I think that I'm being able to cover what the doctor should have been done in these days, because I'm having so many patients to visit now. And Katerine asked her, what are you doing right now? What kind of patients? I have anything. I mean, there are people who are really scared of the COVID-19, so they come to me and ask for advice. What have I do to prevent the COVID-19? And she showed them how to do the proper hand washing techniques. Or other people who already got the COVID or have, you know, a cough or a cold or rheumatism or other sickness in there. And she ran out from her health kit of medicines, like everyone in the rural community. So she started using the knowledge that she has of the medicinal plants. She was she has attended in early January and February our workshop of natural medicines too. So you can see that like the three little bottles in her hands made of syrups and other natural medicine plants extracts. So she used those to attend and actually cure their patients. So this is one of our nicest stories during the pandemics, and
Right. She ended up having to just treat symptoms, and that worked for many patients. Yeah.
Yeah, and also doing some prevention, because some people in the rural community didn't want to acknowledge that the COVID-19 was real. And I don't want to talk long about that, but in the rural area, we had a problem with many people stating that they didn't think that the COVID-19 was real. That was just an invention of, of the government in order to get more votes in the next election. So there was just a manipulation. That's why they didn't take their precaution for the COVID-19.
Right. Can you speak to, Dino, kind of along those same lines, just how Etta Projects has really responded to support the communities once we were allowed out into communities? Can you just talk briefly about how we've been able to start back up again?
Yeah, of course. So we were allowed to go out to the communities in the second week of June. So thanks to Catherine, our doctor, who had a special permission to go out to the communities, we could go and reach finally our health promoters. So in these pictures, you can see the people with the orange vests are our actual health promoters. So we had the first workshop ever made in June were about COVID prevention. How you prevent the COVID-19, how to recognize the symptoms, what you have to do when you recognize the symptoms, how to deal with a person inside, your household who has the COVID, what you have to do in a rural area if you don't have the equipment or even the medicine. So this is what we have been doing since June of this year. So you can see now that our heroes, our health promoters, are taking, for example, the blood pressures, or with the oximeter measuring the oxygen level of our patients. So oximeters were just like a treasure in Bolivia in May. I mean, you could not buy one for less than maybe $300. So even in the rural clinics, they didn't have the simple oximeters. So we bought them thanks to the project, and every community now has an oximeter. So we could go and take them all the face masks, all the coveralls, the jumpsuits. And now we have another side projects with the ACS, with another organization that's called Bridge of Life. And together with them, we are going and see and catch who are recognizing the high-risk patients in the community. So who are the diabetical, who are the hypertensive people, the one with kidney disease, the obese, overweight ones, because they are the ones who are the most exposed to the COVID-19, as you may know. So they are doing the follow-up of those patients, and from August until November, and we're trying to do until January, they're just going every day to do a home visit and see if they are just doing a change of their lifestyle. So now we are training the health promoters in how to cook a good plate with all the nutrients with not so many fats, with not so much meat, and also that about physical exercise, how to make some aerobical stretching, in order to change habits little by little, so they're doing well. I went 3 days ago to Buena Vista to one of our workshops. They are really engaged with the activities, and they told many stories about their patients, about people who didn't even know that they were diabetical until they, went out and visit them with a glucometer, and find out their level of glucose in their blood, Also, another thing that's going on in Bolivia with the kids is that from the breakout of the pandemics, they were kids, of course, were not allowed to go to school. So virtual classes were organized. You can imagine that in the town, in the urban area, the signal is good enough, and many. I would say that most of the family could attend the classes, and spend that money weekly to buy the service, the megas, to connect to the internet. But in the rural area where our community are, of course, there are so many obstacles to that. First of all, because of the connection issues. Second of all, internet connection is not priority to them now. So that's why they wouldn't spend even $2 or $3 weekly, because food or medicines were the priority during the last months. So in many communities, kids just stopped from maybe an education. And what's really bad, and what's the news that happened in July of this year, is that the education ministry of Bolivia declared that the school year ended in that month, in July, and all of the kids, all of the students passed to the next year, not even having given or an exam, or not even seeing what level are they, and
Dino, hang on just a second. I just want to remind people that Bolivia has a different is in a, their fall is our spring, blah blah blah. So school starts in February and ends in December. So unlike when you hear school ending in July, that would be good in our country, but not there.
Yeah, sorry. Thank you, Pennye. Yeah.
Yeah.
So, and there, they started in February and they shut in the last week of March. So they attended school for 1 month and 2 weeks, maybe, this year.
Wow.
Yeah, no, that's very, very bad. And that's why we decided together with Pennye and with the staff to try to give some answer and to the most active communities that we have. So we delivered to the little school. It's a primary school in Isama 2, that's in Buena Vista, a kit of 22 books with activities for each level, for each kid. And the teacher were going there every week, twice per week, are teaching them on that same book. I don't know if we have the picture that we can show.
Kat, you should have that picture.
I think it's in the ELF. Yeah, this is one of the 3 classes. This is the first grade, second and third grade all together. So these little kids received these manuals, and it's full of drawings and really simple readings and maths, and it's what they can have to do this exercise together with the teachers. So it's been a limited activity, of course. I mean, we're trying to reach more communities who need this kind of of service too, you know, because teachers, sometimes teachers are getting lazy, you know, in this time. So
Well,
because
many times the teachers don't live in the communities, and so
yes,
they're not there naturally. And then the government is providing no packets whatsoever
yeah,
for teachers to be able to give to students. So we just worked to find something that we thought would work with primary school,
yeah.
and we're able to print those. So helping out where we can. So Dino, thank you. I'm gonna let people ask you questions. We're coming
Welcome.
in, and just there's 15 more minutes approximately before we need to close out. But I would just like to open up, and we'll just do what we did last night, and everybody can just ask the questions they want to ask. And Susanna and Amanda can chime in too, and Ariel is on, and talk about their experiences as well if you want.
I have a question regarding the woman that used the medicinal plants on patients. Did you say that she was able to use the plants to actually cure COVID or just get them through the symptoms?
So she was able to get in through the symptoms
Okay.
because, through the medicinal plants at the moment, even though we had some workshop with a natural medicine doctor, I mean, there has been no cure at the moment that's 100% working, you know.
Okay.
But you know, they're using many medicinal plants to cure at least the symptoms and to have the lungs heal faster.
Okay. So
Yeah.
so it makes them comfortable through the illness, but they survived, right?
Yeah. And
Okay.
many people actually survived. I mean, we had the really similar histories in other communities. For example, in Mataracu or Villa Imperial, where in these communities there were 2 doctors and 2 nurses attending. I mean, in normal times, 3 of those got COVID-19. So just 1 nurses for more than maybe 600, 700 people in that district could just attend people. So our ACS were the ones who attended people, and the one in Mataracu, which is far away from the Imperial, for example, I would say like 21 kilometers, were alone with 21 people who got COVID, who got cold, who got fever, and other illnesses. I mean, there were a community with a bunch of sick people, and they did it thanks to medicinal plants, because in early May we weren't allowed to go out there and give them some medicines or other tools. So they did really great. I mean,
Great.
they were heroes actually.
That sounds
Thanks.
really good to me. Because a lot of even the mainstream medicine in Bolivia, maybe you can provide more detail, Dino, but some of the medicines that they were dispensing at the hospitals were, to me, very concerning. Ivermectin,
Yes.
sodium dioxide, things that I don't know if they're, I don't know how they got approved for use in the hospitals in Bolivia, but I think it was, they were just trying to do what they could. But some of the medicines they were using to me were pretty concerning.
The ivermectin was used first in May, and actually there was, I'm saying that Nancy, he's asking, are they testing for COVID? So there were experiments made in April, in May here from the Ministry of Health. Katerine, that's working in the healthcare system or the public system, told me that they were sent out to the markets and telling people that for prevention, they should have a shot of ivermectin. So some of you maybe know that ivermectin, firstly, was invented for animals. I mean, it's for veterinary practice. And then there was for human, I mean, the ivermectin for human, but the shots, I mean, to inject people were the doses for animals, you know. And sadly, in Bolivia, they made this mistake of having like a public experiment on people, the sellers in the market, because they were the main ones who were exposed to the COVID-19. So they wanted to see how the ivermectin worked in their bodies, you know. I don't have the you know, statistics or, you know, any scientific data, but, you know, from what Katarina told me, she said that she would never prescribe an ivermectin to their patients, you know. And, you know, now there are other medicines that came out over the last months, but yeah, I mean, this was how bad was here during the first months, actually.
Well, we've been given some pretty bad advice too from our leadership. Everybody take your dose of bleach after this.
Oh yeah, don't do that, please.
We don't want to go there, Pennye.
I know. Anybody else have a question?
I wanted to add something about
great.
what's happening. Sorry. Is somebody else speaking or is it feedback?
It's you. Go.
Okay. Yeah, so here in Buena Vista, or at least in the rural areas, like out where I am, I've seen a lot more people relying on like traditional medicinal knowledge about using plants and different types of foods to strengthen their immune system, which doesn't necessarily mean prevention of COVID or addressing the symptoms of it, but there's an enormous market now for honey. Everybody seems to want honey, and the same with garlic. People are buying up tons of garlic and ginger, and the people who are selling garlic and ginger are making a lot of money because it's expensive now, and the honey is also expensive, but people are finding the money to be able to invest in these things because they know that it's going to strengthen their immune system. So that's definitely a positive thing. And I also read a headline today in the Santa Cruz newspaper that said that the United States had donated over 45,000 face masks and face shields and gloves and medical gowns that will be distributed in 50 different hospitals around Santa Cruz. So the focus is always on the city, which is unfortunate for the rural areas, but it's nice to read something positive about like U.S.-Bolivia relations.
Mm-hmm. Thanks. Any other questions?
I've got some.
I figured you might, Doug. Go.
Just as a little background, Dino, what part of Italy do you come from?
Mute. I struggle with the unmute and mute sometimes. So I'm from Sicily. I'm from South Italy.
Oh, interesting. Maybe we'll have an opportunity to talk about that sometime.
Pleasure.
It's interesting you talk about the heroes. So capsuling what you said about the heroes in the community.
Yeah.
They're using the tools they have to the best of their ability for success.
Yes.
Simply put, is that right?
Yes.
How do you reach out, or how are people reaching out to commend those people for the leadership that they're showing?
So you're asking if people are basically trusting them with what they do while attending people, the patients, or, you know, how to get the connection.
Yes.
How are they being rewarded?
Yeah. So
acknowledged.
Well, in the communities, our ACS, I mean, now they've been health promoters for more than 2 years. In the picture that we shown them, these are our last cohorts. So people during in the community during the last months and especially in the last years, they have seen them in many health fairs, in many health campaigns too. So they are pretty recognized from many people, from I would say the majority of people from the neighborhoods in their communities. They don't receive actually any income or any economic knowledge, because we clarified that during the presentation of our project during the first year. I mean, if you want to do a health promoter, you're not doing that to get a high income or an income at all, because you do that on a vocational basis because you want to be useful for your family, for your neighbors, for your whole community. And of course, you can have an opportunity for your future if you want to keep studying nursery or medicine. The certificate that Etta Project gives is recognized by the health ministry. So it's like a first step towards that goal if they have that goal in their life. So we have people, I mean, from past projects that became nurses that are working in local rural clinics, for example. And I know for sure that in these cohorts that we've seen in the pictures in Buena Vista and San Carlos, some people will walk the same paths of someone in the past, So I think that they are really acknowledged by doctors first too, because I mean the doctors and nurses from local clinics called them to tell them, okay, you go and visit Doña Maria, for example, or Don Juan, because they need some shots of something, So that's why I dare to call them heroes, I don't know if this answers to your question.
Yes, thank you. I have three others,
Yeah.
but they can be shortly answered. What influence is Bolivia having, positive or negative, from the other countries around them? And I'm saying attitudinally, in how the government of Bolivia is addressing this issue.
Well, for example, I mean, most of the countries here in Latin America during the same months have the same period, more or less, of lockdown and isolation. Bolivia actually was the one who, where the breakout was late. In comparison to, for example, Brazil or Ecuador or even Peru. I mean, the numbers here are not that high. Even that, if we relate the numbers to our population, because in Bolivia there are 10 million people as Bolivian, so the numbers are high. So normally, I mean, the exchange between, the countries around Bolivia were not so deep during the lockdown. I mean, Bolivia and the ministry, the health ministry and the government had really a lot to cope with internal problems. So apart from donations came from United States from time to time and Europe as well, there were no other influences, I'd say.
How about attitudinal influences? For example, Brazil, Argentina.
Well, the Argentina and Brazil, especially Brazil, was not a model for Bolivia, and that's I'm really thankful for. So people, I mean, especially the government, was aware that not wearing face mask or not applying the social distancing would have been an issue. So I mean, I would say that starting from April, there were lots of radio advertisement or even on the internet or on the TV, showing advertising to raise sensitiveness to the COVID-19, for example. So I'd say that Bolivia was reinforced by, for example, Peru, I'd say, but not Brazil or Argentina.
Thank you.
Yeah.
How many deaths would you estimate in Bolivia?
So up to now, I have the data here in my notes. We had, and up to yesterday, 7,500 deaths all over Bolivia and 130,000 positive cases.
But that's recorded deaths, Doug. I'm not sure that counts all the people.
Yep.
This is yeah. I mean, normally, I mean, the people who died in their homes or even in the streets or, in local clinics, sometimes the private are not accounted in that number.
Mm-hmm. How do you look after yourself?
Well, not going out so often, just going out to the supermarket. When we are going out to the community, for example, we make sure that we wear our jumpsuit, the cover of the face mask. I have the sunglasses put on and the hat, for example, and always buy gel and alcohol with me. So I try not taking high risk and not going out if not necessary. So now things here are not so strict as they were in May or in June. So people are allowed to go out normally, not in Saturday or Sunday night, but otherwise they can go out anytime they want for all the time they want.
Last question. You're saying now they're allowing groups to get together.
Yeah, I mean, no, not in the, for example, in the discotheques or karaoke's or, sometimes if now the gym are open, but they can attend only up 30% of their capacity. And so are the cinemas and the restaurants, or should be.
Yes. Thank you, Dino.
You're very welcome, Dan.
Anybody else have questions? Susanna, Amanda, you want to add anything? Dana, is that a question?
Yeah, I've got a quick question, and Dino kind of alluded at it. But so here in the US, we all flocked, once COVID was kind of spread out throughout the US, people went crazy and pulled toilet paper off the shelf and were hoarding it. Did anything like that happen in Bolivia? Was there I know it's hard to come across personal protective equipment, but was there something, a resource or a food that was unavailable that you just couldn't get for months on end?
So for example, here in Montero, we didn't have problems with almost anything, but I would say that this because the local reality of Montero that had several markets or even the supermarket opened every morning. I mean, we didn't have many problems with the supplies. The problem we had, and the same ones were with the rural communities, is for medicine. I mean, even here in Montero, who had a lot of drugstore, pharmacy, we were able to buy even ibuprofen. I got a very high fever in early April. We thought that it was COVID-19. Eventually, it was not COVID, it was dengue. And I couldn't afford even to buy the ibuprofen because it was too costly, it was too expensive. One single tablet costed each 100 pesos, 100 Boliviano, which is more than $20 each. So it's crazy. I mean, no one could afford that, as you can imagine. So I don't know if maybe in the rural community, I don't know if maybe in Buena Vista, Amanda or Suzanne can talk about anything that was missing or not available there.
There weren't large shortages, but I think some of the limitation on getting foodstuffs at times was you could only go out one day a week. So if the truck for flour hadn't come to town on Monday and your day out was Monday, then you were stuck without flour until someone else in your house could go out, or until next Monday, and things like that. But early on in the pandemic, everyone, the diet here, there's a lot of bread consumption. So in the first few weeks, there was no yeast anywhere in the markets because everyone started making bread at home because the markets weren't open and people weren't allowed to work in the afternoons and they couldn't go get their bread when it came out of the oven at 3 o'clock down the street. So everyone started making bread, and it was yeast for the first 3 weeks, maybe a month. But then after that, there were no real problems.
Gasoline and eggs. Gasoline was really hard to get. You had to get a special permission from the mayor's office in order to go and get in line and wait for 4.5 hours to get a certain number of liters of gasoline. And that is extremely limiting for people who are living in rural areas. Most people, this endless waiting game. And then for some reason, there were never any eggs. So now, that's changed a lot. But like Suzanne said, I'd have to get up at 5 o'clock, leave here at 5 o'clock in the morning to get into town to be able to get the shopping done before 7 a.m. so that I could, one, avoid getting full body fumigated by the soldiers, but also to ensure that I could get some produce to feed our staff here, because by 7 a.m. it was all picked over and mostly gone.
And the gasoline might not have actually been a shortage, just a rationing, because it was actually not allowed to drive. So it wasn't so much that there wasn't gasoline, it's just no one had permission to drive, so no one should be buying gasoline, so only the authorized vehicle should be able to get it. So there was no way for people coming from far away, like from Tecuati, to really fit into that structure.
Yeah.
And I don't know if we have time for this, but I just thought it would be really interesting if Camille could just say a few words. She lived in Santa Cruz and Montero for so many years, recently migrated to Peru, and has suffered the entire quarantine in Lima, and she's a nurse. So, and she's worked for Etta Projects, so I thought it would be interesting just to hear what's going on there.
In Peru, it's very regional. Certain regions are in quarantine and others are not. And obviously, I think about 1/3 of the entire Peruvian population lives in the city of Lima, or like the metropolitan area of Lima. So the government made a pretty impressive effort to scale up the hospital capacity, focusing first on Lima because that's where the cases really, the first outbreak was focused. And since then, of course, from Lima, it's spread out to the whole rest of the country. But there's always been certain areas of the country at a different moment in time, and it's a different region that's suffering the greatest number of cases. I think that's kind of common, the common trend in any country. That's been every country going through this. But certainly, there's been hospitals in other cities around the country that were lacking in ventilators or ICU beds. But I would venture to say now there's not a big issue with lack of resources for the most part. But I would say occasionally I do still hear about oxygen shortages and price gouging with oxygen. Yeah, it's always like a influx here too. We get one announcement one week that we're allowed to go out until 10 p.m. and then the next week they say, oh no, you have to stay in, you can't go out on Sundays. So they're always kind of trying to tool around, and I don't know if it's to make it seem like they're doing things to respond to the problems as they fluctuate. But I would say, being in Lima, I would say mostly there hasn't been a shortage of beds, but that's not the same in the smaller cities and definitely in rural areas. I also heard of huge hits to the healthcare professionals, like doctors and nurses dying also from treating people. And yeah, that was definitely a reality here.
Well, and we've seen a lot of that in Bolivia as well.
Mm-hmm. I have a question, but I don't know if it's too late and you need to wrap it up, but I have another question for Dino too.
For me,
go ahead.
Mm-hmm.
Go ahead.
Or, well, for any of you all that are in Bolivia, maybe now that things are after the initial panic and the initial shock happened, I think that I understand things are a little more under control now, but I might be wrong. You can correct me on that. But since the hospitals maybe regrouped and organized better, has the public health system been then going back out into the communities to try and do any more work like educating and supporting the ACS that are there? Or have the communities continued even till now to be on their own?
So now all of the doctors who were sent out to their urban hospitals, likewise in San Carlos or in Buena Vista, now went back to their original clinics. So now in Espejito, in Guaitú or Villa Imperial, there is a doctor plus the nurses that were originally working there. So, they didn't reorganize, they reorganized the work within the healthcare staff in the local clinics, and in general in Santa Cruz, and I would say in Bolivia, the government has made lots of investments for the third level hospital. In Bolivia, there are 3 levels of the hospital. So the basic one with a really simpler attendings and services is the first. Then there is the second, where there is some surgery, and just in the third one there are things like the intensive therapy. So now, for example, Montero as a third level hospital who has at least 10 intensive therapists that are working, and also lung ventilators. So they are reorganizing and equipping the clinics, but the third and second levels. The first level and the local rural clinics are receiving more supplies, but still the focus of the government at the moment are the main cities and the bigger hospitals, because still we are receiving calls from our ACS asking for more medicines.
Well, thank you everyone for coming. And Dino, and Amanda and Susanna, thanks for showing up from Bolivia. And Camille, thanks for showing up from Peru, and Doug from Canada, and everyone else from the US. We appreciate that. And we hope maybe to have some more education sessions some other time, maybe cooking sessions or whatever, but just to engage with some folks that we love. So thank you very much, and go out there and look at the auction and see if there's something you can live without.
Thank you all. Thank you for reaching us out.
Good job.
Stay safe.
Thank you very much.
Thank
Love you all.
Thank you.
Bye.
Bye.
Bye, Suzanne. Bye, Amanda.